Psychoanalysis, Kohut, concepts made easy for practice. One of the tragedies that has happened to psychoanalysis in the last 2 decades has been sidelining of Kohut and his precious work. Part of it has to do with Kohut himself, who could not clearly articulate some of his concepts, their scope, limitation, and the contradistinction between his concepts and those in classical psychoanalysis. Because of Kohut's limitations in not being very clear about his concepts and a clear demarcating line where the classical approach would end and his approach would become more relevant, or how the two can be integrated, this led to a very mystical, obfuscating kind of theory. And this was one of the reasons why it got sidelined. Second reason has to do with his followers. His followers crossed the line and went completely out of control and navigated into areas which were difficult for anyone in psychoanalysis to accept as reasonable. Third was, there is a genuine difficulty in understanding 2 different approaches, the approach of classical psychoanalysis and the approach of Kohut, self-psychology, how the two can coexist together, how they are not mutually exclusive, and how is it that when we see classical psychoanalysis operating and giving us results, how can something that completely denies it or is completely on the other side of the bank, how the 2 banks of the river can both be true at the same time? The fourth reason is the structural and functional location and conceptualization, the structural location and the conceptual functional conceptualization of Kohut within the model of the mind as it exists in the Western tradition, it is very difficult. How do you put Kohut's concept of self in Freud's, Jung's, or any other model of the mind? And Kohut himself did not produce a model of the mind where he can put his own concept of self, integration, coherence, and so on. And while all of this is true, these are the limitations of Kohut himself and his followers, and therefore the limitations of the school and the practice of it. Yet with all of it discounted, it remains that it's one of the valuable schools of psychoanalysis. It has some priceless concepts and discoveries which we should not allow to get lost into oblivion. It is therefore time to return to Kohut, just as Lacan returned to Freud. We have to return to Kohut, to revisit Kohut, learn his priceless contributions, and take forward the enterprise of integrating Kohut into classical psychoanalysis. And this cannot be done unless we expand on the model of the mind. And there, one good way would be to integrate the Eastern models of the mind. And I have done that by integrating Sri Aurobindo's model of the mind And in the context of Sri Aurobindo's model of the mind, we can redefine the self and the ego and have a very clear-cut boundary about what Kohut calls as the self and how it can be related to what Freud calls as an ego by partly redefining ego into different constituents. A unconscious ego, a social ego, and the biological ego. And once we get into this kind of a clear definition of the ego, we can define the self more clearly, and then we can more clearly deal with the pathology of the self and the healing of the self, which Kohut has described brilliantly. Where Kohut failed was to go into the constitution of the self, the formation of the self, in terms of a structural model, and therefore create tools to analyze the nature of disintegration of the self, and therefore the tools to enhance the cohesion of the self. Tools which go beyond the cohesion therapy into something the person can do himself, or some tools the therapist can use apart from the classical cohesion tools. So Kohut is very important. However, it is not easy to read Kohut and learn him directly. In my past lectures, first on introducing Kohut in my book FAQ Psychoanalysis, I have given out the basics on whom you can read about Kohut. So go to the book FAQ Psychoanalysis for the first introduction to Kohut. Thereafter, go to my videos on lectures on YouTube on Kohut. There are, I think, 3 lectures on Kohut. And after that, you can look at this lecture. Talk today comes about because in the last lecture, I discussed concepts of Kohut, but it was felt the discussion is not easy enough. It is difficult to put into the practice. So for the purpose of practice, I'm making it more detailed and easy today. And it will be a long talk because I'm trying to cover as much as I can. If it becomes too long, I will construct it into a series of lectures of half an hour each. It may lead us to 3 or 4 lectures of half an hour each. So let us go into it today. How does Kohut look at crisis? What is a cohesion crisis? So to summarize what we have done before, Kohut looks at pathology in this way. Kohut calls his discovery of pathology as self-pathology, which means Kohut is adding one more line of pathology. He is expanding our compendium of pathology. So Freud brought about what is called the drive frustration pathology. Intense desire frustrated by reality or morality leading to problems. Klein brought about the object relations pathology. And Kohut brings about another line of pathology, the self-pathology. As Kohut brings about the line of self-pathology, he is not saying that Freud's line of drive pathology does not exist, or Klein's object relations line of pathology does not exist. What he is saying is he is adding one more line of pathology. And what he is saying is this, that there is a distinct line of pathology called the self-pathology, and this comes about in terms of pathogenesis in a very different way than the line of pathogenesis that is put forward by Freud or Klein. And two, healing of this set of problems cannot be done in the classical approach of psychoanalysis, and it requires a completely new self-pathology approach to heal patients suffering from this line of pathology. And this new approach of healing is the approach of Kohutian therapy, which is radically different from classical psychoanalytic therapy, although it is within the arcade of psychoanalysis. Secondly, the understanding of pathogenesis and the diagnostic structure is completely different in Kohutian school, the school of Kohut, the school of self-psychology, than you find in classical psychoanalysis. So let us look into the diagnostic structure of self-pathology. I have discussed this part, what is the self and what is self-pathology, but to just go into it quickly, Kohut says there is something called the self, which he does not define, which comes very near to the ego, but is not the ego. Self is the sum total of the personality. At the same time, self also appears as some distinct entity of the system. And Kohut says psychological problems occur in many ways. You can have a Freudian line on which psychological problems occur, a Kleinian line, a Bionian line, a Jungian line, Winnicottian line. But one more line is the line of self-pathology. And when problems occur, psychological problems of the nature that they fall on the self-pathology line, then we have to understand that there are two kinds of self, a healthy self and unhealthy self. A healthy self is strong, cohesive, integrated, stable, happy, positive, and industrious. This is how a healthy self is. And of course, healthy self is not something who will come to therapy. We are essentially dealing with the unhealthy self. Now, if because of some reason, constitutional or childhood experience or later trauma, a healthy self is not developed, the healthy self develops essentially in the first few years of childhood. Safely, we can say the first 5 years, but a large component of it will be in the first year or first 2 years at the most. Largely, it will be in the first 2 years. Now, this healthy self, if a person has good constitution and good childhood experiences, he develops a healthy self and he goes on healthily with life. He does not become, this area is not a concern of psychotherapy. For some reason, if the child does not have a good constitution or good childhood experiences of early life, he develops an unhealthy self. And therefore, later he comes to therapy. Now, unhealthy self, according to Kohut, can be of 3 types. a narcissistic unhealthy self, a borderline unhealthy self, or a psychotic unhealthy self. And we are moving from narcissistic to psychotic in terms of increasing pathology. So the narcissistic self is more healthy than a borderline self is more healthy than the psychotic self. And this is the diagnostic structure of Kohut. That he says that the self pathology in the line of self pathology, essentially we are dealing with an unhealthy self, and the unhealthy self is of three types: narcissistic, borderline, psychotic. Narcissistic, the most stable and the strongest within the three, relatively speaking. Psychotic, the most sick. So it is like bad, worse, and worst. Now the question therefore is, how do we understand the pathogenesis of an unhealthy self? Why does an unhealthy self develop? What psychological phenomena happen in early life? And of course, all psychological phenomena will happen because of involvement of both constitution and environment. But what are these phenomena which occur in the mind early life that we ultimately end up in an unhealthy self? And if we understand the reasons, then we can go for a corresponding way to heal those reasons. So what will lead to formation of an unhealthy self? Kohut goes into this, and Kohut lists out 12 reasons, 12 phenomena, which are at the root of constitution of an unhealthy self, be it narcissistic, borderline, or psychotic. The more things go wrong in these 12 areas, the more you move towards the psychotic self. So Kohut talks about these 12 phenomena. The first is mirroring. And we will go in details of all the 12 because I have been told that in the last lecture, it was not easy enough to put it into practice. So we'll make it easy enough. So what we'll do is we'll go into details of each of these 12 phenomena. Let me just list out the 12 phenomena. Mirroring, idealization, empathy, self-object experiences, twinship experiences, alter ego experiences, impingement, holding, arc of tension, self-cohesion, disintegration, and transmuting internalization. These 12 phenomena have to occur in a certain way for a healthy self to develop. If something goes wrong in these 12 phenomena, an unhealthy self develops. And the more things go wrong in these 12 areas, the more unhealthy self develops. So if these 12 go completely wrong, you end up in a psychotic self. If something is semi-wrong, you end up in a borderline self. And if something is quarter wrong, you end up in a narcissistic self. That is the kind of pathogenesis that Kohut goes into. So let us go one by one into each of the 12, and that will help you to use these concepts in practice. The first concept is of mirroring. We use the concept of mirroring in psychotherapy in a variety of ways, but Kohut uses in a very distinct way. So let us just review how we use the concept of mirroring in psychotherapy and then come to the Kohutian use of the concept. We use the concept of mirroring. One use of the word mirroring in psychotherapy is to mean approval. Some people use the word mirroring to say approval. That the client was looking for approval and I provided the mirroring. That is one use. Second use of the word mirroring in psychotherapy is used to mean validation. The client was looking for validation and I provided him with mirroring. Third use of the word mirroring is in reflecting back the irrational that the client is expressing. The client says, I don't want to get well. And you repeat it back and you say, yes, I can understand. You are saying that you don't want to get well and you feel that is the right thing to do. I can understand your point. It is reflecting back the irrational onto the client. And suddenly the client realizes the irrationality of what he is saying. This is the third use of the word mirroring. Lacan uses the word mirror face, not exactly mirroring, but his use of the word mirror face is to talk about that early phase of life before the ego is able to bring everything under a coordinated control, where the child feels himself completely disintegrated inside, but sees in the mirror an image of himself as one consolidated whole. And this leads to what Lacan calls as mechanism, a creation of a false image, that the child creates and holds on to a false image of a one consolidated integrated whole, when in fact inside he is completely disintegrated and not cohesive at all. It's a fourth use of the word mirror, not exactly mirroring, but mirror. The fifth use of the word mirror, which I have not put here, is the use of the phenomena of gaze in the mirror to look at narcissistic infatuation with oneself. That is also one use I have seen in psychotherapy. And then we come to Kohut's use of the word mirroring. Kohut uses the word mirroring to mean 5 things. So he says, if there is a mirroring failure, that can lead to formation of an unhealthy self. And this mirroring failure may be the single most failure, or may go along with a combination of other failures to create an unhealthy self. So we are in a over-deterministic situation. Any of the 12 can independently lead to creation of an unhealthy self, or any of the 12 can combine with other elements of the 12, the set of 12, to lead to creation of an unhealthy self. So it's an over-deterministic situation. So Kohut's mirroring. So let us look at the mirroring failure of what Kohut calls as the mirroring failure. And this we find very commonly in personality disorders. When therapy goes deep enough in personality disorders, usually we do come across a mirroring issue. And what does Kohut say about mirroring? Kohut uses the word mirroring to signify responsiveness from the parents, the positive responsiveness from the parents in early childhood. It is like do the parents act as a positive reflecting mirror, or do they act as a silent mirror, or do they act as a negative reflecting mirror? So when we go to some Disneyland kind of places, we see different kinds of mirrors. In some mirrors, you see yourself exactly as you are. In some mirrors, you see yourself better and bigger than you are. And in some mirrors, you see yourself smaller and worse than you actually are. And in some mirrors, it's completely opaque. You just don't see yourself. And this is the sense in which Kohut uses the word mirroring, that what kind of mirrors the parents or the caregivers are in early childhood. And Kohut's mirroring can be elaborated in terms of 5 A's of mirroring. The 5 A's are acknowledgement, attention, acceptance, affection, and admiration. When we say mirroring has been successfully done by parents, it means the child has got adequate acknowledgement of his existence. His existence has not been dismissed. It has been recognized. So you recognize his existence. You don't take him for granted. You don't dismiss him. Second, after having been acknowledged as existing, people don't go about in the room as if you don't exist. They acknowledge your existence in everything that they do. If that is rightly done, the child does not have to do anything dramatic to get acknowledgement for his existence. The child is saved from histrionicity. The second is attention. Having acknowledged your existence, do they give adequate attention? And of course, we are using all the 5 A's in the positive sense. That the acknowledgement has to be positive. It cannot be non-acknowledgement, or it cannot be a criticism of somebody's acknowledgement as to why you exist. You are a burden for me. You have spoiled my life. It's better if you die. So these 5 A's, we are looking in the positive sense. If the 5 A's are not positive, it can be either a silent mirror or it can be a negative mirror. We are looking at the positive mirror. So the acknowledgement has to be there. If there is no acknowledgement, or you are cursed for be existing, acknowledgement failure happens. So this is a mirroring failure of a particular type, the acknowledgement failure. Then you can have attention failure. It is also a failure of a particular type of a mirroring failure, attention failure. People don't give you adequately positive attention. They give you either no attention at all, or they give you a negative attention. And therefore, getting adequate positive attention is very necessary. If you don't have acknowledgement and attention positive enough, it can lead to histrionicity or avoidance or narcissism or any of the personality disorders. In most personality disorders, we will see that most of the 5, or at least a majority of the 5, have not occurred rightly. Third is acceptance. Acceptance of what you are, so that you don't have to create a false self, or you don't have to have anger against yourself for what you are, or you don't have a dismissal of what you are, or you don't have a guilt or shame about what you are. Affection, which makes it safe for you to relate. The first 3 tell you, I am good enough. And the 4th tells you, the other is good enough. It is safe to relate. It is pleasant to relate. So the first 3 deal with I am good enough. The 4th deals with The other is also good enough. It is safe to relate. The world is a safe place. And the fifth is admiration. That it is safe to do something in the world, be industrious. And my initiative will bring me admiration and fame. And it will not bring me criticism, mocking, and shame. It is safe to take initiative in this world. It is safe to work. It is pleasant to work. It is pleasant to be venturesome. It is pleasant to be creative. It is pleasant to go out into the world and do something in the world of work. So all these five are elements of mirroring. When somebody is going out of one's way just to get acknowledgement for one's existence, that is one particular kind of failure. It has to be pointed out in therapy and worked through. And all the five, of course, are healed in therapy. And cohesion therapy focuses on these five more than the classical Oedipal interpretation or object relations interpretations. And Kohut says that we have to allow the client, by holding back interpretation and providing holding and empathy, to live out these elements in the therapy room for a long time before we turn to the classical way of psychoanalysis by doing the classical interpretations. Unless we address these five according to Kohut, and if we directly go to classical interpretations, the pathology goes even more repressed than before. So this is how we can look forward to using the concept of mirroring by using these 5 A's in therapy. The second is idealization. How do we understand the concept of idealization? Kohut talks about the second area of idealization, which has to go right to develop a healthy self. So what do we mean by idealization? Idealization means in early life, the child has to see that the parents have some ideals in them. There are some values they cherish. This also means not only that they have morals, but that these beliefs are stable. And you can rely on the parents to abide by these beliefs. The other is not completely the unpredictable other. He is a predictable other. There is a stability. He is not a bipolar or a multipolar other. He is a stable other. And this stability comes in terms of something he believes in, something he behaves by. So there is a clear cognizance of ideals in the caregivers, stability and reliability around those ideals. There are things they cherish. There are things they look up to. And they are good enough to abide by this. They are good enough to have adequate sense of moral values, good values. And these values include being sensitive, being compassionate, doing good mirroring, having good morals, happily taking on responsibility, and thereby becoming good role models. So the child gets a good role model. The child also gets standards which are higher to abide by. And he sees the caregivers aspiring towards that standard, stretching themselves towards the standard. And the child sees competence, industriousness, resilience, hard work in the caregivers. The child sees courage. The child sees a high sense of aesthetics and taste and high sense of standards in choices, in thoughts, in expressions, and in action. The child sees the caregivers getting social respect, and the child sees the caregivers being happy even as they undertake this arduous task of living by ideals and standards in their life. And when the child sees this, he is able to internalize that part of people around him and awaken his own sense of morality, develop his own superego, develop internalized stability, reliability, internalize a good role model, internalize the ideal to develop competence and feel safe about it and happy about it, and respect his own high sense of taste and develop it further, and aspire to safely go for search of social respect by good work. So this provides the child with a moral development, a stability development, a role model, a positive goal, and cherishing of competence, courage, and taste. Uh, if this failure occurs in early childhood, the child is bound to look forward in society or in therapy for role models to complete this process of idealization. This is where often people go to spiritual gurus because they don't find role models or ideal enough persons around them. Third is empathy. Empathy, as understood in Kohut, is very different from normal use of the word empathy. The use of the word empathy in Kohut is quite extensive in its meaning. Empathy means the following things in Kohut. First, it is understanding the other, the readiness to understand the other, to take efforts to understand the other, even if it is difficult, even if it takes time. It is to put oneself on the back seat in terms of some of our urgencies and priorities and take time off and a complete absorption, a complete attention to understanding the other. It is not a token listening, it's a profound understanding, a real understanding. Second, empathy goes into a profound acceptance, an unconditional acceptance of the other. That does not mean you admire the limitations of the other or you don't have moral choices. Of course, you have a moral position. But there is an unconditional acceptance of what is before one slowly tries to reform it. Initially, it has to be an unconditional, profound acceptance. Third is attunement, where you attune to the other in such a way that often you are able to give words to what he is feeling unconsciously, and he is thankful to you that you have verbalized to him what is unconscious in him. Fourth is sensitivity. That you are sensitive enough to go into the delicate part of the person and explore him and make him aware of his own sensitivity, a very deep sensitivity usually repressed. Fifth is compassion. That you show compassion to him and don't come hard on him. Sixth is forgiveness and pardon. Forgiveness is to forgive what he may have done to you either in therapy or outside. Usually it is in therapy. He may have assaulted you verbally, or he may have held back payment or not come on time or cancelled without saying anything, something of that sort, or lied to you or hidden something from you for a long time. This forgiveness and pardon. Pardon is not only to forgive, but bring it to the positive pre-forgiveness stage, as if nothing has happened. Not that you forget, but you forgive positively, and you come back to the same positive stance before the event happened. So pardon is one step ahead of forgiveness. This definition is from Master Chua Koksui, the creator of pranic healing. But it's a very useful concept in Kohutian context. A sportsman's spirit for having healthy competition and allowing things to go when you are defeated. A positivity to look at the positive aspect of things. Every sinner has a future and every saint has a past. See the positive in people. Encouragement. We allow expression of deeply repressed, delicately held, protected desires, and encourage the person to express and then pursue them. Approval and validation in some cases. Support, and the support can go from sharing of information to giving knowledge to showing interest in something that somebody wants to ideationally develop, or help him with some information for development of the enterprise he is embarking upon, or help him in execution. The entire range of activities in support, and help him to build resilience. And often this comes by being a role model of resilience oneself in front of the person. All this constitutes the word empathy in the Kohutian context. So often if people ask, how do we practice or how do we identify the point of empathy in doing therapy? This is how you can deconstruct the word empathy in the Kohutian context and practice it in therapy. Now, what happens when empathy is rightly shown in therapy? Of course, we are referring to Kohutian therapy for today. Self develops, and by self we are referring to Kohutian self. Self develops in presence of empathy. Empathy is understanding with attunement, attunement. Empathy is a skill of attunement. Deeper empathy is just not holding, but doing something positive, what we saw. One important part of empathy is containment. And the containment is not only passive containment, there is an active containment also. You can look at my lectures on Kohut when I talk about containment, passive and active. So containment, passive and active, and is a dynamic part of empathy. Especially active containment is a dynamic part of empathy. You don't only contain something, but you process it, convert it into something positive and give it back. And the whole process is unconscious. You can also talk about empathy and the childhood of the client in therapy. By referring to the fact or analyzing in terms of this fact that mothers are comfortable with the cohesive self of the child, not a disintegrated self. And they actually attack the child when the child's self is disintegrated instead of helping him to reconstitute a integrated cohesive self. It's also true that in society, most people are comfortable with a partially disintegrated self where the other has anxiety of your attack. And that is a defense against attack from an integrated self. People are afraid of an integrated healthy self. Empathy provides security to make mistakes and yet not expect an attack. Now, what does empathy do? Empathy provides a safe world. So what templates are created in the client's mind when you practice empathy in therapy? First, the world is a safe place. The world is a good place. The world is a kind place. The world is a gentle place. And the client is able to internalize that empathy, the empathic environment, into a self-soothing core inside and into an empathic core which he can express with others. So this is how the practice of empathy goes. The understanding and practice of empathy goes in the Kohutian therapy. Third concept in Kohut is about self-object experiences. I explained the concept of self-object. It is self-object. Self and object are not two different words. It's a one word connected by a hyphen. So it is not self-object experiences. No, it is self-object. Self-object, one word. Self and object are not two different words. They are connected by a hyphen. So self-object is one word. And why Kohut created this? He wanted to say that the child requires self-object experiences in early childhood, by which he meant the child has to experience a relationship with the other in a way that the other does not have a mind of his own. The other does as the child wants him to do, and therefore the child experiences the other as an extension of oneself. And if the child's desire is satisfied enough, slowly the child realizes that the other has a mind of his own, and he moves from a narcissistic position that the other is an extension of oneself to a realistic position that the other is a distinct other with mind, desire, and will of his own. However, if the self-object experiences are not adequately experienced, the unsatisfied desire converts into a narcissistic trait of experiencing the desire to experience a self-object experience, of relating to others as though the others were an extension of oneself. They ought to do what I want them to. So it creates a narcissistic position if adequate self-object experiences are not experienced in early childhood. So let us go in slight detail to make it easier. Self-object experiences allow the child to experience omnipotence in a dyad. Experience it enough so as to satisfy the desire adequately so that one can move from here into a realistic situation. If the desire is not satisfied enough, you get fixated there. and develop an unhealthy self, mostly a narcissistic self. Someone is there the way I want him. This is a very important realization in the mind of the child, that there is someone, an ideal object out there. So these are very initial object relations where one is still trying to live out one's omnipotence through control. And if he is able to live out, it enables him to say that there are objects out there exactly as I want them to be. And it powers him up for even more object relations. He is not frustrated at the first outward movement in object relations. If it is frustrated, the self becomes a narcissistic self, and the narcissistic position is expressed in the three phrases that if you wish to relate to me, and if I am a narcissist, all you have to do is three things in life. Life is very simple. Love me, obey me, and please me. This is the only way to relate to me. And this is an outcome of frustration of early life self-object experiences. Kohut also talks about exploitation. Winnicott also talks about exploitation. That the self-object experiences have to be deep enough that the child not only controls you but occasionally exploits you. And the mother has to allow the child to exploit her. Make her satisfy his undue demands. And scarcity of such experiences can lead to a fixation there. Fixation on experiencing a relationship where one can exploit the other. And often, after adequately exploiting the other, there is an intense feeling of guilt and remorse and an intense transformation of oneself. Of course, there can be the other element also if there is no morality, that it can lead to a psychopathological situation. That, of course, is the other extreme. But for most people, it does not go there. Usually, there is a guilt and remorse. And the turn is taken towards reparation, gratitude, and reality. The good self-object experiences allows the child to have the experience of the good other, helps form a strong cohesive self. And if that does not happen, he does not find the good other, then in personality disorders, we often see people say this is something they want to say, but they are not able to express, especially men. And if you turn it, you can apply the same to a woman also. A narcissistic man would say, I am yet to find a woman who can heal me. And this is true. The healing at the roots often cannot be done completely in therapy. One needs a living experience of a woman who can do all that in early childhood the mother could not do. And this can be at the root healing for some people with a narcissistic framework. And you can turn it around, and a woman might say, I am yet to find a man who can heal me. Or if the woman has a problem with the mother, she would still say, I am yet to find a woman who can heal me. Or if a man has a problem with the father, he could say, I am yet to find a man who can heal me. So as the pathogenesis, so the healing. But this is very common for most narcissistic men when they say, I am yet to find a woman who can heal me. What does good self-object experiences lead to? It leads to these templates in the mind, of course, in the unconscious. I am good enough. I am competent enough. I am in control. I am not helpless. I am not powerless. The other is loving, obedient, and pleasing. There is no threat of the other. I feel safe with the other. I also feel it pleasant with the other. Slowly, there is a movement from omnipotent position to a realistic position, from omnipotent power to realistic power. And there is no hesitation in owning up that realistic power. And the core is you realize object relations is a pleasure. And that's half the battle won. Fourth concept in Kohut is the concept of twinship. Let me take a break of 10 minutes and continue in the next second session. Take a cup of tea and come back.